What's up, guys? I'm here and I'm going to show you the Thomas test. The first thing you're going to want to do is have your patient just standing there, and you're going to want them to line the top of that table up with about the top of their butt cheeks, and then I'm going to want him to grab his left knee and bring it up to his chest and just fall back like that. So first thing you can do is just get a quick visual inspection of what their knee and leg is looking like. Just look at the angles of the trunk to the hip and then the thigh to the lower leg. So if you're going to see tight rectus femoris right away, they might present something like this, because the rectus femoris is a two-joint hip flexor, meaning it runs over the hip as well as over the knee. So they will present like this because that muscle is tight, therefore bringing this angle up to make it shorter. All right, so next what I'm going to do is I'm going to straighten out his leg, and with this, it should allow his hip to drop and extend a little bit, because when I straighten this leg, I'm making that rectus femoris shorter and kind of turning it off, and then that would be a positive for rectus femoris and hip flexor tightness. The other muscles that might be tight in that position are sartorius as well as TFL. Next, I'm going to bring his hip out to an abducted position. What that does is it further isolates the rectus femoris, kind of turns off that sartorius as well as the TFL, which are abductors and hip flexors. So same thing here, I'm just going to straighten out that leg, and if I see that hip being allowed to drop further because the tightness of the rectus femoris has been turned off, that means that will be a positive for hip flexor tightness, especially rectus femoris in that abducted position.